For the last couple of decades, Access has provided services to folks who are living out in the community where they live, in the homes or apartments where they live. For a long time, we believed that our job in the whole scheme of things was to provide supports to people where they lived, and that the housing world would provide the space or the places for them to live. What has happened over the last decade is that housing costs have skyrocketed. People's income can't keep up with that. The availability of housing has diminished greatly. So lots of the people that we serve in our different programs are now impacted by not having sufficient housing or adequate housing or sustainable housing. A big goal of ours in expanding our housing service line is to integrate the services that we already provide to support people while they're in their house with the capacity to get access to housing and obtain housing in the first place. Montgomery County has the fourth highest eviction rate in the state. And so while we have a growing number of people who are homeless, we also have more and more people finding themselves homeless for the first time or becoming homeless again. Housing and homelessness is really a community level issue, and it happens in all of our communities and it impacts all of our communities. An example is Ann and Jeanette. I met them while they were living in a park in a tent, and the borough passed an ordinance that said they could not be in that park, and so they moved to a bike path nearby, and then they were told they couldn't live on the bike path, and then they ended up in a hotel where they were paying for their own hotel stay, but it was very expensive, and they were losing ground. They couldn't financially keep up with that. We were able to help them get into an apartment where they are now. We used donations to do that. Through the generosity of folks in the community, we were able to turn that donation into really a life for these two women who had been outside for quite some time and been unstably housed for quite some time. One of our goals as an organization is not only to provide a service for folks who are experiencing homelessness, but to partner with the community and sort of leverage the capacity of the community to respond to its own need. Oftentimes when we talk to people about what conditions get somebody to be homeless, oftentimes the idea is that somebody has a mental health issue that they've not gotten treatment for, or they have a substance use issue, or somehow they've made a life choice where they're using a drug, and if they would just stop that, then things would be okay. And really, the biggest driver of homelessness is economic. About half of the people who find themselves homeless have economic issues related to their health care. So they get sick or they have medical bills that they can't pay, and that compounds their financial situation. There's no legal place for people to live outside. It's almost a combination of hide and seek, where you just stay hidden as long as you can, and musical chairs. The minute you get found, then you're told you have to be somewhere else. The survival need is really the thing that drives it. And in the rest of the world, we say, why can't you budget? And why can't you think ahead? Why can't you plan 4 days out? And the answer is because when you're in survival mode, that's not actually helpful. That will get you hurt if you think too far ahead. What we've seen is when people get inside, then they're able to sort of move forward. And that's why we say housing first is a thing. When you get people into housing, it brings with it a stability, even a sense of safety and security that you don't have at all ever when you're outside.